So it's a great pleasure to welcome Mihaela van der Schaar, who is the John Humphrey Plummer Professor of Machine Learning, Artificial Intelligence and Medicine at the University of Cambridge, and also the founder and director of the Cambridge Centre for AI in Medicine. And her talk is called How Faithful is Your Synthetic Data? Sample level metrics for evaluating and auditing generative models. Mihaela, I hope I said your name right, by the way.
Thank you very much for the kind introduction. We are talking about artificial intelligence and how data science more generally can transform a variety of economies. But in order to be able to do so, we need to have high quality data. And in many settings, from scenarios such as healthcare to finance, we need to have access to data that possibly has privacy consideration and constraints. So today I'm going to talk about how we can generate synthetic data to be able to harness the potential of data science and machine learning. So I'm going to talk today as a main application about healthcare. But the reality is that everything I'm going to describe here refers to any sensitive data: financial data, criminal justice data, education data. We all know that we can catalyze a complete transformation in many domains as long as we have high quality data using machine learning. For instance, in medicine, we can improve clinical flows, empower patients, enhance drug development, do discoveries. But this is challenging because data is not easily and readily available. And this is the result of perfectly valid concerns regarding the privacy of such data. For instance, in healthcare, there are very strong regulations from HIPAA and GDPR that prevent sharing of such data with the machine learning community. One more challenge associated with this is that GDPR and HIPAA have strong regulation, but this regulation is mainly written in terms of words rather than algorithmic requirements. So at times it is even difficult to understand and translate into concrete formalisms the regulations associated with this. They are ambiguous at times and difficult to implement as a regulation. And because of that, data is often not shared, and this impedes machine learning research and the potential it can catalyze. So one solution that people are often using is anonymizing or de-identifying data. And that is taking real data and removing personal identifiers or scrambling data fields. But this is not often a good solution. First, often data that may be anonymized may still be disclosive, despite everything that has been said. And the reality is that we hear a lot in the media about this. Also, at times the data is in such a way anonymized that it is becoming useless to do machine learning or anything useful with it. So synthetic data represents a solution to this, where we are creating data from scratch, and if modeled properly, we can no longer identify the individuals that form the real data. But in order to create synthetic data, we need powerful and new machine learning and statistical models. Today, I'm not going to have the time to go into the details of the entire technology, but let me say that my lab has been the pioneering lab in synthetic data, and we started to talk about synthetic data 6 years ago as a solution to sharing data with the machine learning and AI community. Now, many people are talking about it, and this is becoming increasingly a reality, but there is still a lot further to go. If you are interested to hear more about the details of the technology beyond what I'm going to talk about today, please look at our tutorial at ICML 2021. The uses for synthetic data that go beyond the anonymous data are the fact that we can develop analytics. We can facilitate reproducibility of clinical studies and analysis, but also we can augment small sample data sizes. And that is important because in the data, there may be either rare diseases or in other environments, there may be underrepresentative subgroups of people. And if we are not using synthetic data as an augmentation technique, we may learn machine learning models that may be biased. Also, synthetic data can improve the robustness and adaptability of machine learning models. And we are able to transfer models that will learn in one environment and one setting, for instance, one hospital to another hospital and potentially to another country, as we have seen in COVID-19. Even more importantly, we can simulate forward-looking data. This is not possible with data anonymization. Here, though, with synthetic data, we can envision and simulate the future. Inclusively, we are able to create simulations in which we understand what is the effect of different policies as applied at different moments in time and create a variety of counterfactual scenarios. One more time, if you are interested to hear more, please take a look at the ICML 2021 tutorial that we have given. Today, I'm going to highlight just two of the key aspects of this tutorial. There are two key questions associated with synthetic data: how to build a machine learning model to generate synthetic data, and how to evaluate the quality of such synthetic data. Again, one important reason why we want to generate this synthetic data is because we want to break the data logjam in machine learning in a variety of settings, such as healthcare. And if we are able to do that, then we can create an ecosystem where the synthetic data can be created on the basis of the real data, can be then shared without privacy concerns with the data users, machine learners, data scientists, statisticians, etc. And then the tools that have been generated on the basis of such synthetic data can then be sent back to the original data owners. So this is shown in here. We can see how private data is generated using synthetic data, then shared with the machine learning community, and then the machine learning models are imported back to the original data owners such that they can use this powerful analytics. What is really important here? It is important to consider these two facets, the generative aspect and ensuring privacy requirements of the synthetic data. So for that, we have created a recipe for generating synthetic data. In the first step, we decide the generative model approach to use. And there are many machine learning models that can be used. The most popular ones are variational autoencoders or generative adversarial networks. In the second step, we are constructing an appropriate representation structure depending on the type of data and the modality of data that we want to generate. For instance, dealing with time series data, with images, with natural language processing, or even with other data modalities. And as a third step, we are incorporating privacy notions that are desired. For instance, we could use differential privacy, but this is often a concept that doesn't easily extend to complex settings. And at times what we want is to have, for instance, GDPR requirements being fulfilled. But this needs to be turned, as I mentioned before, into algorithmic language that can be then ensured and guaranteed. What types of generative models? In our lab, we have used a variety of generative models with different types of properties, some using explicit likelihood models, some using implicit likelihood models. And many different types of machine learning models have been built on top of that. Let me just give you one particular example. If we want to take an available data set in healthcare, for instance, an electronic health record, we may want to select in this recipe a generative adversarial network and construct a representation in the second step using a neural network and use a GDPR privacy notion. We have done just that a few years back when we created for the first time an algorithmic notion for GDPR compliance that uses and extends the idea of key anonymity. And then we use generative adversarial networks trained using this particular framework while making sure that the data that is generated fulfills the identifiability losses defined through GDPR compliance. In this way, we can generate high-quality synthetic data with GDPR privacy requirements. What about time series data? This is even more complex because we need to preserve temporal dynamics and we need to capture the distributions of features within each time point as well as the complex dynamics over time. In this case, we need to change the different ingredients in the different recipes and select different models at these different steps. Here are three different examples. So we have created very high quality and pioneering work in synthetic data generation, either using time guns for data-driven high-dimensional data, or in the case we want to have interpretable state-based models, we use attentive state-based models, or if we want to have periodic data as well as irregular and variable length time series data, we combine this with ideas from normalized flows and Fourier flows. So as you can see, different machine learning models used to generate synthetic data with different types of characteristics and different types of fidelities. This brings me to the final point. How can we make sure that the data that is generated is any good? When we started this topic around 6 years ago, we were the first to do that. But in the last couple of years, everybody is generating synthetic data. And we started to believe that a lot of the data that is generated is not of high quality. So 2 years ago, we have created a competition at the biggest artificial intelligence and machine learning conference, NeurIPS 2020, which we call Hide and Seek. In this particular setting, we created two different sites. On one hand are the hiders, and these are researchers that generate synthetic data. On the other hand are the seekers, the ones that are going to try to re-identify data from the synthetic data. And what we have done is, together with several partners, we have tried to envision this two-sided competition in such a way that we can understand what is the state of the art in the field of synthetic data generation, as well as privacy considerations. And what we realized out of this competition is that actually it is extremely important to define very clearly metrics for evaluating synthetic data and privacy preservation. Because a lot of the data that is generated is actually not of high fidelity and it is highly disclosive. So this has started a new agenda in our group where we look at new and more powerful ways to identify the quality of synthetic data. And now at the Turing Institute, together with Accenture, we are furthering this agenda by looking at the quality of synthetic data with respect to three dimensions. Fidelity, which enables us to understand how good the synthetic samples are, diversity, how much of the real data is covered, and generalization, how often does the model copy the training data. These are just three different notions, but we are going to look at many more. So as a key message, a final message, I'd like to say that synthetic data is clearly a very important AI technology aimed at enabling us to generate data that can be used by machine learning researchers and data scientists more generally to develop powerful analytics. It is also extremely important because it can help us augment small sample data sets, and in this way we can guard against model biases. And as a matter of fact, in the very recent NeurIPS 2021, we have shown how we can generate synthetic data with ethical and fairness guarantees, which is extremely important. This also enables us to increase the robustness and adaptability of machine learning models, as well as transfer models that have been, understand whether we can transfer models that have been created in one particular location, a country, or an ecosystem to another. Part of this is also evaluation of synthetic data. So I would like to warn everybody considering the use of synthetic data to make sure that the data is indeed assessed with respect to a variety of quality metrics. Also to realize that an important new frontier is to generate forward-looking data that enable us not only to look at how, for instance, data evolves over time, but how it can change if different policies are implemented. For instance, in healthcare, if treatments are given, or for instance, in finance, if different policies come into effect. And a step in that agenda is this synthetic data generation for decision modeling, where we have built for the first time a methodology that is enabled to generate synthetic data with different types of policies and policies models, such that we can test decision making in a closed loop environment. Thank you very much. And if you would like to read more about this research, I invite you to take a look at our research pillar dedicated to synthetic data, where you can find a vision, papers, as well as software. Thank you.
Thank you very much, Mihaela. That was absolutely fascinating. And yes, tantalizing. You kept saying, well, come over and we'll tell you some more of the gory details. We've had a number of questions come in through Slido. If you have another question, you've probably still got time to add it and it will get fed through to me. But one of them actually springs pretty much directly from one of your closing points, which is, do you have to take extra precautions when you're using synthetic data to be sure that you're not introducing bias into your models? I mean, you kind of touched on that there with the fairness and ethics. Would you like to expand on that a bit and say what are the particular pitfalls and how do you guard against them?
Thank you very much. So this is something that we realized actually while running this competition a few years back, when we realized that a lot of the data that was generated had multiple types of biases that existed already in the data and further enhanced those biases. So what we realized at the time is that what is extremely important is to use synthetic data and make sure not only actually that these biases are not further reproduced, but even better maybe correct some of these biases in the data. So this new technology that we just have published recently, which has a very nice name, it's called DCAF, is actually, so it's easy to remember at this hour in the day, is actually using causality and causal graphs to be able to learn from data relationships and then apply different types of algorithmic notions, of algorithmic fairness notions to the data when generating such data. So we combine a variety of ideas to make sure that indeed such data doesn't propagate and doesn't increase, but rather decrease the biases present in the data.
It sounds as if, in fact, part of the process of generating synthetic data forces you to examine and notice and measure the biases and be able to do something about them in the synthetic data set that you produce. So is it possible you might end up with less biased data sets from synthetic data than if you simply use the raw data from the real world?
This is exactly, thank you for this point. This is exactly what I was trying to say. I was trying to say that in this new technology that we have developed, this is exactly what we have shown. We have shown that while quite a lot of bias existed in the original data, we are able to apply different types of algorithmic fairness methods, and everybody may have a different notion of fairness. And let's be honest, notions of fairness keep evolving as society is evolving. So what we find fair today, maybe we will not find fair in a few years' time. So it is extremely important to define correctly the notion of fairness, which falls outside the scope of this particular research. But then we can bring these notions of fairness and we can generate data that has these fairness guarantees. But this brings a point. There could be that there is bias in the data that we do want to preserve. For instance, the demographics, the comorbidities of people in the UK may be different than people in the United States or the Netherlands, and we want to keep those differences. These are not biases. These are really distributional differences between these different countries. And there may even be some biases associated with the healthcare system, for instance, or the economic system in which this different data has been acquired. We do want to preserve those such differences because only then we are able to make sure that when we train a model in one particular data set and we are generating data from another location that has these different characteristics, it can be tested accordingly. So I want to point out that while generating this data, we could generate it according to different characteristics and constraints, inclusively eliminating biases, but also creating diversity if this is what we want.
And that actually brings me on to another of the questions that's been submitted, which perhaps goes the other way. How do we ensure that models trained on synthetic data retain authenticity when you apply them to real world data? So I think that maybe touches on what you were just saying, that actually the reason real world data is biased is sometimes because the world is biased, or at least variable. So is that a problem the other way, and how would you tackle that?
Very important. This is a fantastic question, very important. Let me say first that we talk extensively about this in the tutorial of 2021 about authenticity of data. So if you are interested to hear a little bit more geeky talk, please listen to the ICML 2021 tutorial. But let me say that this is something that we realized again while assessing the quality of the data. And we realized that many of the synthetic data sets that exist currently are not having the right coverage. So many people are underrepresented actually in this data. And well-known measures of, let's say, quality of synthetic data didn't take into consideration that actually a lot of the authenticity of the data was low actually, and patients, for instance, or underrepresented groups were disappearing completely from the data, which is not something we want. So measuring the authenticity of the data and looking at outliers while making sure that, of course, these outliers, these people that are somewhat different than the rest, are well represented. At the same time, the privacy considerations are preserved, because we would not want to compromise the privacy of this underrepresented population.
Yeah, because normally they would be easier to identify because there's only a few of them in the data set. Right, got you. Yes, so it could be actually really
interesting trade-off, and this is why it's a complex problem that we are studying, and we have some initial solutions, but there is an entire research agenda. And actually, this is one of the important topics we are looking at the Turing Institute together with Accenture.
And somebody actually has just put in a question, but you've almost exactly answered it about the trade-off between privacy preservation and synthetic data. But I think you've answered it already before you even heard it. That's how efficient synthetic data is. Your question's answered before you get a chance to put them. So I just want to try and get a couple more in before we have to move on. One which a couple of people have asked is, can you give us an examples of situations where synthetic data would not be the appropriate thing to use?
Well, so generating synthetic data. So one important scenario is when you do not care about the privacy of this particular data. Then there is really no good reason for you to use it. In some other cases, it may be very difficult to generate synthetic data that has the fidelity you need for the task that you are interested in. So there are complex scenarios with multimodal data, high-dimensional data, sparse data, where currently we do not have, as a world community, amazing solutions. In that case, one needs to be very careful about the use of synthetic data, because again, we may want the synthetic data to be able to generate from real data, synthetic data, to train models. And if the models generated on the basis of this flawed data are then deployed on the real data, they are going to underperform. So we need to, of course, consider the efficiency of the data for the task at hand.
Very good. I can see it pains you to say that there are still a few situations where it's not. Although, as you say, sometimes it's just not needed. How important is explainability? How important is it that you can actually tell people exactly how you got from the original data set to the synthetic data?
This is a very interesting question. So as a researcher working a lot on machine learning for medicine, explainability is a very important issue, and I've given a few years back a Turing talk associated with interpretability and explainability, so please check it out if you are interested in that. But there is about explainability of machine learning models that may be black box. But here, the focus is of generating the data on the basis of which machine learning models, black box or white box, can be trained. I want to point out that synthetic data can also be used for statistics, for epidemiology, for other settings besides black box machine learning. So I would say that the issue of explainability is key if we are talking about machine learning models that may be black box and we want that the decision makers understand the predictions made. But in this case, I would say this is less important. What I think it is more important is to understand the correct metrics to measure fidelity, authenticity, privacy. This is what's important. But since we generate data rather than models predictions, it is very easy to understand and really to understand what data has been generated. That being said, there is something not about explainability, but something related. We can do auditing of this data, if you like. We can audit what samples generated by the synthetic data model are more or less authentic, more or less noisy, more or less representative. So I would say the correct notion here to think about is not explainability, but rather auditing of this data. So I'd like to introduce maybe a new concept of auditing the data. With respect to all these different metrics. And then you can train a machine learning model on the basis of it, which, if it is a black box model, you may want to explain and interpret.
So is that auditing something you could transfer back to real world data to assess how, I mean, obviously it's authentic because it's real, but how biased it is, how noisy it is, how representative it is? Are those techniques that you could take back again from your synthetic data?
This is another brilliant question. Yes, this is actually a general topic, doesn't apply only to synthetic data. Like you say, as we are progressing in the machine learning agenda, we increasingly realize it's not only about the models, it's even more about the data. And there is an entire research frontier in machine learning now about data-centric engineering, but my own lab is taking a slightly different approach, is really trying to understand noise in data, errors in data, systematic errors in data, as well as, like you rightly say, bias that's due to the decision maker. So it may be a human decision maker that may have biases that may have acquired data about a particular population with this particular bias, and we are trying to understand it and quantify it. So you are, I'd say, completely right. It's a very, very important related agenda of trying really to understand how we can build machine learning models and data science models to understand noise, error, bias, systematic bias in the data and its impact on the models that are built on the basis of such data.
And finally, I don't know if you can answer this, but have a go. Could synthetic data have helped us find a cure for COVID sooner than we did?
Oh, this is a very interesting question. So as a machine learning researcher in healthcare, I worked closely early in the pandemic with NHS Digital to build machine learning models for empowering clinicians and patients. And one of the biggest challenges was that this data in the very beginning of the pandemic was only available in some settings and not others. In some countries, there were better quality data than us. In some were worse across different hospitals because the pandemic was at different levels. So definitely synthetic data is a very important piece of the puzzle because at times we couldn't. So I was working with both the UK, Brazil, and the Netherlands on COVID, and we couldn't exchange this data across these 3 different countries. But in addition to federated learning, which at times poses its own challenges, synthetic data, I would say, is a very good solution to exchange data easily, such that we can learn from each other early in a pandemic like this one. And we can learn not only about making predictions, but also about policies. So if you are interested about this particular topic, I would invite everyone to look at the policy impact prediction work that we have done using learning, using synthetic data across different countries in the era of COVID-19. So definitely.
Brilliant. What a perfect note to end the Q&A on. Thank you very much, Mihaela. That was absolutely
Thank you for the opportunity.
and thank you for answering all those questions so interestingly.